We are back. Welcome back to our next Tuesday topic. Today we're going to talk about jumper's knee, or Osgood-Schlatter's in the medical definition. Basically what this is, and it happens a lot during puberty. Kids are growing a little bit more. Maybe they're doing a lot of club sports, getting a lot of overall activity. We have a lot of tension and tightness basically in our quads here. Kids are growing, it makes them tight. They're running around a lot, makes those things tight. And all those muscles basically combine to form our patellar tendon. So that tendon down there where you get that reflex, that's the tendon that attaches on a bump in our knee. Long story short, we can have a lot of tension there that kind of pulls at that point, and with the growth plate still being open, we can have many little avulsion fractures that kind of go on there. So that it may get red, it may get really, that bump may get really big, inflamed, hot, stuff like that. Basically what we need to do as clinicians, one, we got to calm down that inflammation, use some laser, some dry needling, stuff like that, just to calm that down. But at the end of the day, we got to take this tension out of the quadriceps, out of the thigh muscles to give that area some relief, basically. So we'll do a bunch of that, and also we got to do some stuff to turn on the glutes, get the hips going a little bit more, to take some pressure off of the quad, off of the knee. So we can actually see, my drawing doesn't do it justice. We can see over here the quadriceps forming into that patellar tendon, and they insert on the tibia, on your shin bone right there. We all have that bump. So with jumper's knee or Osgood-Schlatter's or growing pains, as some people may call it, we have little mini, and if it gets serious, a little avulsion fracture of that bump. It kind of gets all irritated. So if your kid's dealing with some of that, they're playing some soccer, they're doing a lot of stuff with their running around, they're growing a bunch the past year or so, give us a call. I bet we can diagnose it properly and kind of get them headed in the right direction. So jumper's knee. Hopefully you learned a little bit about anatomy, learned a little bit about what we do here. So thanks for tuning in, guys. We'll catch you next week.